So NuCalm, as Dr. Holloway will talk about tonight, was developed by Dr. Holloway after years of working with folks with extreme trauma, suffering from post-traumatic stress disorder, addictive diseases, and really looking for a way to help folks without using narcotic-based pharmaceuticals and conventional methodologies. We brought NuCalm to the medical community and beyond through dentistry. It's, I think, a rare opportunity for dentistry to lead the advancement of applied neuropsychobiology, and it's something we're very proud of. In September of 2010, we launched NuCalm commercially through continuing education in dentistry. And from dentistry, we literally have been welcomed and created opportunities in professional athletics. We've been working with professional athletes and Olympic athletes for over 4 years, and they came to us through dentistry. We've been working with some of the leading cardiologists, neurologists, obesity, medical weight loss clinics, psychotherapists, alcohol and drug rehabilitation centers, and all of these opportunities have come to us through the dental chair and through people coming in, trying NuCalm, and then further exploring it. So that's been a fun piece of the puzzle. It's not a everyday occurrence that an applied neuropsychobiology product comes to the world through dentistry. And so I think tonight we probably have 90% of the folks on the phone who are dentists. So thank you for helping us create a lot of buzz and help a lot of people into other verticals. In fact, we have quite a keen eye on the NHL Stanley Cup playoffs. For those of you who are clients, you know that the Blackhawks have been using NuCalm for over 2 years. It won the Stanley Cup last year, and last night clinched their trip to the Western Conference Finals. And we have a team in the East that's a NuCalm team, so we're hopeful that we'll have a NuCalm Stanley Cup final, and then we'll figure out who we want to root for this year. So we've got 1 minute to go, and then we're going to have David Poole, Vice President of Marketing and International Business Development, introduce the call, do some housekeeping issues, introduce Dr. Holloway. Then we're going to have Dr. Holloway speak for about 45 minutes. We'll have a Q&A for about 10 minutes following Dr. Holloway's presentation, and then we will end the call promptly within an hour out of respect for everybody's time. So it is 8:30, so David Poole, would you please begin tonight's call? Thank you.
Thank you, Jim. Like Jim mentioned, my name is David Poole. I'm an executive with Solace Life Sciences. For those who know me, I've been working with Blake for now 5 years, and I have to say on a personal level, he's obviously got a very remarkable brain, but it's what you do with that really counts and matters, and he's got the most compassion I've ever met from anybody, and he's certainly been one of my personal heroes. And with that, I want to introduce Blake. I've got an abridged version of his background. It would take 40 minutes to do him justice. And with that, let me introduce Dr. Holloway. His undergraduate studies were at Sorbonne University in Paris. His graduate studies at Oxford University and the London New School, where he achieved a Master of Philosophy in Behavioral Science. His postgraduate studies were in a medical university in Lyon, France. I won't do the French injustice by trying to describe the name. He received a PhD in Chinese traditional acupuncture, naturopathic medicine, auricular therapy and its derivative, auricular medicine, and homeopathy. His heuristic activities include the Biological Physics Study Group in San Francisco, the Institute of Functional Medicine, where he's been a member for 20-plus years, the Society of Traumatic Stress Studies, the European Society of Biofeedback, the APPB in Europe, and the Mind Science Foundation. Several of his noted mentors include Valdine Brown, PhD in nonlinear neurofeedback, neurooptimal and neurofeedback, Fred Alan Wolf, quantum physicist, Beta Strittmatter, MD, Chief Instructor of the German Academy of Acupuncture and past President of the German Auricular Medicine Institute. His experience includes 30-plus years in the field of applied psychobiology and neuropsychobiology. Specialized fields of study include post-traumatic stress response, autonomic nervous system imbalance and disease states, especially autoimmune diseases, anxiety disorders, affective disorders, addictive disease, applied clinical nutrition, formulation consultant for professional-grade nutraceutical formulas, human peak performance and contemplative neuroscience, sensory, motor, auditory entrainment, neurophysics, metabolic nutritional functional pathways, applied frequency-specific microcurrent and biological upregulation, and neurofeedback and heart rate variability biofeedback. He developed a novel, nonlinear, dynamical clinical application for anxiety, depression, sleep disorders, and addiction. His inventions include NuCalm and 4 additional neuroscience medical inventions awaiting patent issuance. And he's the acting chief science officer for Solace Life Sciences, and is a private practice in naturopathic medicine with neurology specialization. And he's the founder of Applied Metabolic Sciences, an educational and research foundation providing health service providers the latest research, education, and clinical applications in functional metabolics. So I introduce to you Blake Holloway.
Well, I'd like to welcome you all to our little chat this evening. I want to start with a little bit of an overview of stress-induced dysfunction. This is going to be a little bit of a biological rendering. The NuCalm clinical tool has a number of applications, but all of its applications and all of what we mine out of the NuCalm clinical tool is very much around the modulation of the central and the autonomic nervous system. So I'd like to just do a little bit of an overview of what happens with stress-induced dysfunction. So in today's fast-paced society, the vast majority of individuals are under a constant barrage of stressors. These stressors are translated by the neuroendocrine system into signals that alter the body's biochemistry to support a fight or flight response. While some of these changes may be beneficial to survival in the short term, what we call acute stress, they present an increased risk of various physical and psychological health challenges in the long term, or what we call chronic stress. There is no doubt that stress is an inevitable consequence of modern life. Fortunately, the downstream damage caused by it is not. So let's look how we can define stress. Stress can be defined as any perceived physical or psychological change that disrupts an organism's metabolic balance. Surveys and research reports conducted over the past 2 decades reveal that approximately 43-45% of all adults suffer adverse effects due to stress. In fact, 75 to 90% of all visits to primary care physicians are in some way related to the adverse impact of psychosocial stress. Furthermore, an estimated 1 million workers are absent on an average workday because of stress-related complaints. The market for stress management programs, products, and services has skyrocketed in the past decade and is estimated to currently exceed maybe $15 billion annually. While all age groups are affected by stress, the aging population faces compounded susceptibility to stress-induced disorders because of the accumulation of problems mediated by chronic long-term stress. We can't talk biologically about stress and its effects without discussing the hypothalamic pituitary adrenal axis, what we call the HPA axis. The central nervous system acts as an antenna that translates stressors into biochemical signals filtered through the HPA axis. In general terms, a stressor is perceived by the limbic system which stimulates corticotropin-releasing hormone in the hypothalamus. Corticotropin-releasing hormone then travels to the pituitary gland, where it triggers the release of adrenal corticotropin hormone. That, in turn, triggers the production and the release of stimulants we call glucocorticoids, such as cortisol from the adrenal glands. The hypothalamus also stimulates the adrenal medulla via the sympathetic nervous system to release catecholamines, such as epinephrine, which we call adrenaline, and norepinephrine, or noradrenaline. Glucocorticoids and catecholamines induce a variety of behavioral, biochemical, and physiological changes, collectively termed the stress response. For instance, the release of glucocorticoids and catecholamines during stress result in increased alertness, elevations in blood glucose, blood lipids, increased oxidant production, and an increased heart rate. In the acute stress scenario, these induced changes serve to increase the organism's chance of survival. So in chronic activation or hyperactivation of the stress response, this chronic activation of the hypothalamic pituitary axis brought on by repeated exposure to stressors can cause organ systems to functionally deteriorate as they constantly attempt to reestablish the internal balance that has been perturbed by the stress response. In addition, hyperactivation of the HPA axis can lead to a net excess of cortisol, causing hypercortisolemia. Over time, this hypercortisol produces catabolism. It is neuronal atrophy, loss of bone density, and negatively influences system function at multiple levels. Research also suggests that aging is associated with changes in the regulation of the HPA system, which result in its hyperactivation of excess glucocorticoid release. Stress-induced hypercortisol, as well as the excessive release of catecholamines, may curtail life expectancy by several years via their downstream effects on physiology and organ system function. Chronic stress also impacts the synthesis and activities of aldosterone, thereby influencing sodium and potassium concentrations and extracellular fluid volume. Research increasingly supports the critical role that stress and stress molecules can play in obesity, diabetes, osteoporosis, hypertension, cardiovascular disease, infectious disease, gastric ulcer, cancer, gastrointestinal, skin, and neurological disorders, as well as a host of disorders linked to immune system disturbances. Chronic stress has also been shown to affect behavior in both human and animal models and has been linked to psychiatric illnesses such as depression and anxiety in humans. The vulnerability of a particular body system to stress varies from one individual to another and is determined by genetic, constitutional makeup, and may be influenced by environmental factors. Identifying those with symptoms of HPA hyperactivation will allow for early intervention and the avoidance of stress-related disorders. Special reference should be made to the effect of chronic stress on cardiovascular health, a primary concern for many patients. Recent studies provide convincing evidence that chronic life stress contributes significantly to the pathogenesis of coronary artery disease. Excessive action of fatty acids released through the catabolic process of stress, and cortisol causes insulin resistance, increases the hepatic secretion of glucose, and very low-density lipoproteins. Furthermore, cortisol can decrease the uptake of LDL by the liver. Catecholamines influence heart rate, blood pressure, heart rhythm, and many other parameters of cardiovascular function. Clinical consequences of these effects in the chronic stress scenario may include myocardial ischemia, arrhythmias, endothelial dysfunction, and the potential for thrombosis. So we also we move from hyperactivation to hypoactivation. Interestingly, stress may not only cause HPA axis hyperactivation and attendant problems that I just mentioned, but in certain individuals, long-term stress can result in just the opposite, a burnout or hypoactivation of the stress response. A number of studies now indicate that after long-term exposure to stress, the HPA axis may eventually lose its ability to adapt to stressors, resulting in hypoarousal, the disruption of central regulatory systems, circadian rhythm, and a net decrease of cortisol output. Low cortisol output is associated with a distinct clinical picture and may promote an increased vulnerability to autoimmune disorders, inflammation, myocardial infarction, chronic pain, asthma, and allergies. This process relates very much to Dr. Hans Selye's model of exhaustion. If you don't know that name, Dr. Selye was really the father of stress medicine. This process, which states that the ability to adapt to stress is lost because adaptation utilizes bodily resources and taxes the organ systems. Eventually, one or more systems may break down, resulting in disease. Under normal conditions, a negative feedback loop maintains the balance of cortisol. Cortisol-releasing hormone is modulated primarily by levels of glucocorticoids, but also levels of adrenal corticotropin-releasing hormone, CRH itself. In addition, CRH is also modulated by neurotransmitter systems. When the limbic system, which may include serotonergic, cholinergic, gamma-aminobutyric acid, dopaminergic, and opoid peptide systems. It is evident that HPA dysfunction is far-reaching. In fact, HPA dysfunction may also impinge upon proper function of the metabolic regulator, the thyroid. Deficient, we talk about the HPA axis, but there's also the HPT axis, and deficient thyroid hormone activity may be due to a lack of stimulation by the pituitary gland, distinctive hormone synthesis, impaired conversion of T4 to T3, which is the metabolically active form of thyroid hormone, or perhaps poor T3-mediated gene expression. We're seeing a lot of people today where T4s don't convert to T3s, and you can almost always identify a certain stress physiology in those patients. As we look through the way these various biological, physiological systems are mediated, when we began our research, our research was in the beginning looking for solutions, particularly to people with acute experiences of stress, things that would go in the category of post-traumatic stress disorder. And also we were working with patients that had addictive diseases, and people that are faced with addictive diseases are really faced with a serious life-threatening circumstance, because the number one cause of relapse in addictive diseases is stress and anxiety. And as a matter of fact, I began to get at odds with some of the treatment modalities that were used, because frequently when people would have comorbid disorders, an addictive disorder and a comorbid anxiety disorder, you're left with very few tools to manage that. The pharmacological tools to manage anxiety and stress, which are usually benzodiazepines, are very contraindicated in people with addictive diseases because it can activate a craving cycle. So as we begin to look at and pick apart the biological activities of stress, much of this centers very much around the autonomic nervous system. Your autonomic nervous system controls involuntary actions, those not under the conscious control, such as your heart rate, breathing, digestion, glandular functions, involuntary autonomic response, reflexes. So this beginning of the autonomic nervous system is up in the brain stem, in the area called the medulla. A specific area called the nucleus ambiguus is the beginning of the autonomic nervous system, or what we also call the polyvagal system, because the nucleus ambiguus in the brain stem is the beginning of the vagal nerve. And the vagal nerve is really the expressway down which your stress signaling travels. So while all your other nerves, like in the central nervous system and the spinal column, are all bundled in the spinal column, the vagal nerve, in Latin means wandering, is not encapsulated. It takes a wandering from the brain stem, connects to either side of your heart. There is a sympathetic, which is your more fight or flight, and a parasympathetic, which we call the relax and restore, or the rest and digest. And that innervates completely down into the superior and inferior mesenteric plexus in your digestive tract. That is one of the reasons that when you're extremely anxious, you get a lot of stomach action. We see in people who have had lots of early childhood stress, and otherwise we see chronic digestive complaints. The modulation of the HPA axis really requires a functional negative feedback loop. If you want to really understand what NuCalm is, it is actually a biomimetic or a biological mimicry of the negative feedback loop. So just like you have a thermostat that is set to a certain temperature, when it reaches that temperature, a negative feedback loop would tell it to cut off. People with chronic anxiety and acute stress responses do not have a good functional negative feedback loop. So we have, with the NuCalm system, created that functional negative feedback loop, and that is managed with what we call in the NuCalm system, I call the four-legged stool. The four parts to the NuCalm clinical tool are the amino acid precursor tablets, cranial electrotherapy stimulation, neuroacoustic software, and light blocking masks. When we initially did our clinical studies on anxiety, we had a new laboratory testing panel that had been brought from Germany that actually allows us through urine metabolites to analyze body-based neurotransmitter levels. So when we begin to look and call for subjects for study, we found something very interesting as we began to look at neurotransmitter levels. One of the big neurotransmitter players in keeping the brain cool down and not to go into firing like seizure and otherwise is the GABA neurotransmitter system, the gamma-aminobutyric acid. So what we found in these individuals as we looked at their neurotransmitter levels, we found two very broad differences. One we would expect, where we found low levels of GABA, and then in other studies with individuals, we found extremely high levels of GABA. We couldn't explain at first why, if you had all these high levels of GABA, why these individuals would be anxious or why they would have high stress or anxiety. It turned out that these high levels of GABA were indeed produced by the brain, but they did not go into the neurotransmitter receptor site. The neurotransmitter system in the brain is very much kind of like lock and key. You have a receptor site that's really designed for the particular neurotransmitter. So as these two conditions we found were either extremely low levels of GABA, which would give us we could understand why with extremely low levels of GABA people might be anxious. But we also found a population of people with extremely large numbers of GABA, and we were puzzled because with those numbers of GABA for the neurotransmitter, those people should have been calm. It turns out that those individuals, they produced the GABA, but the GABA did not enter the receptor site, so you didn't have any of the action that you see from GABA. If you think, for example, of some of your pharmacological medications like Dilantin and like gabapentin. Gabapentin is a popular seizure medication, and it operates through the mechanism of upregulating GABA binding. So we were faced with the problem of how would we get more GABA into individuals that had low GABA, and then what to do with individuals that had very, very high GABA. I began somewhere in the middle 70s. I went to Russia a few times and began to look at a technology in Russia that was called cranial electrotherapy stimulation. Russia had a lot of scientists, a lot of people in the area of physics, and as the Soviet Union began to kind of break apart economically and otherwise, many of these scientists went off on their own, and the origin of cranial electrotherapy stimulation came about in the late 60s in Russia. It was even used in some cases for medical electro anesthesia. As we begin to look at the cranial electrotherapy stimulation literature, we found that what we were able to do with that technology was to make the binding sites for the particular neurotransmitter more available. So we created a form of electrotherapy stimulation that is matched up more to what a neurotransmitter receptor site is. And what CES does in the equation is it does something called electroporation. If you're a cellular researcher and you're in the lab and you want to get something inside a cell, you put it in a petri dish, put a mild electrical current through it. That thins the cell membrane. Electroporation thins the membrane and allows what you want to enter the cell to enter it more regularly. And so we get that effect with our cranial electrotherapy stimulation. It also causes the neurotransmitter receptor sites to purge themselves and rebalance themselves. But what we are able to do with that technology, with the part of the population that has the high level of GABA that does not go into the receptor site, this actually causes the receptor sites to present themselves, and the electroporation of the cell allows the GABA to enter the receptor site. Our third leg, first of all, we've talked about tablets, we've talked about the CES. The tablets contain both GABA A and GABA B. Those are specific GABA binding sites. And we also have constituents like L-theanine that help reduce glucocorticoid effect. So the third leg of our NuCalm clinical tool is something we call neuroacoustic software. The patient perceives it, or the person using the system perceives it as sort of relaxing music. But within that music is an embedded series of frequency tones that stimulate something in the brain called frequency following response. So the neuroacoustic software actually affects brain EEG states. So if we look at the electroencephalograph of the brain, we can sort of tell where its attentional states are by looking at the frequency states that the brain is going through. So a person that is highly alert, highly attentive, is producing a frequency range in something that we call the beta range, somewhere between 15 and 18 hertz. That's cycles per second. As an individual gets more and more anxious, that frequency state gets faster and faster, and in some highly anxious individuals, we can see frequency states go up into the 30 cycles per second. Our neuroacoustic software is designed to entrain that down. If you think of the old hypnosis metaphor where they take a pendulum and swing it back and forth, the slower you swing the pendulum, the lower the entrainment state. Entrainment can be produced a number of ways. Entrainment can be produced through light flashes. It can be produced through auditory tones. And our neuroacoustic software, which is designed to take the brain into low-frequency states that come very close and enter the first stage of sleep, is done through opposing beats. That is, if we want the brain to produce 10 cycles per second, we put a carrier wave of 100 hertz in one ear and 110 hertz in the other ear, and the brain actually subtracts that and will produce a standing wave in the brain of 10 hertz or 10 cycles per second. So the higher we are in the frequency range, the more alert we are or the more anxious we are, and the lower we go in the frequency range. So if normal attention is somewhere between 15 and 18, if you close your eyes and take a few deep breaths, you can move yourself down to a range that's something in what we call alpha, which is anywhere from 12 hertz to 8 hertz. And then the next step down the steps to an even more relaxed place is where we go into the theta range. The theta range is anywhere from 4 hertz to 7 hertz. And in point of fact, that is the area where we begin to enter into what we call a hypnagogic state, or a somewhat hypnotic state, and loosening of associations. And in point of fact, theta is your entryway into the sleep state. So many people with sleep disorders are not able to cut off their sympathetic range and enter the parasympathetic system. The fourth leg of the NuCalm clinical tool are our light blocking masks. That may seem like a small thing, but as soon as you cut off light to the optic nerve, you increase alpha wave output in the rear portion of the brain where vision is put together, and it immediately increases your alpha output by almost 30%. So that simple act gives us an extra leverage in taking the brain into that peaceful parasympathetic state. The real goal of the NuCalm clinical tool is that it very rapidly conducts the negative feedback loop from the HPA axis and is able to place that patient into a sustained parasympathetic state for extremely long periods. We've actually had complex dental procedures that have gone on for 6 hours in major restorative work under the NuCalm clinical tool. What I'd like to go into now is what you can expect to see from your experience with your patients. So let's talk a little bit about the acutely stressed patient. One thing to understand about the high anxiety and high stress response is that it affects thinking and it affects perception. So I will give you an example of one of the areas of the brain that is involved in the stress, fight or flight response is an area of the brain called the amygdala. One of the best ways I explain the nature of the amygdala is that if you're out for a nice walk, say, you know, you're going out for a picnic or a walk in the forest or something like that, and you're on a path, and all of a sudden you see a snake, you run back 20 feet, you turn around, and you see that it's not a snake, but in point of fact, it's a crooked branch. The amygdala is designed for fight or flight, and it is specifically designed to shut off the reflective thinking area of the frontal and prefrontal part of the brain. So the amygdala wants you to run for safety rather than reflect on something. High anxiety patients and patients that have lots of high dental fear are very much kind of a victim of this part of the brain because the nature of the fear response literally blocks more complex thinking. It's a little bit like why roaches have lived so long, because their legs somewhat bypass reflection in their brains, and they're just very big movement. So when we place the patient under the influence of the NuCalm tool, we are altering the function of the whole inhibitory side or the parasympathetic side of the autonomic nervous system. When you look at the basic research that we did quite a bit of EMG work. We did a lot of electroencephalographic brain work. We did body temperature measurements, peripheral temperature measurements, and we also did a research measurement that is called heart rate variability. And heart rate variability is a unique way to look into where the set of the autonomic nervous system is, whether you're more sympathetic or where you're more parasympathetic. That measure, incidentally, was confirmed at the Ray Institute for Advanced Biophysiological Signaling at Harvard University. Dr. C.K. Ping is the co-director there. And that is an institute that looks at biophysiological signaling almost in terms of quantum physics. So one of the things that you're going to observe in the patient that is under the influence of the NuCalm clinical tool is there are also motor strip effects, as you can bring some sedation to the autonomic nervous system. You will be very pleased to notice that your gaggers will really have less gagging. You'll notice both around the shoulders and the neck, and even the grasping on the dental couch, that will begin to cease as the patient enters this structured parasympathetic side of the autonomic nervous system. As you place the equipment on the patient, it takes from the ingestion of the tablets about 5 to 7 minutes for a deeper induction to begin to take place. Therefore, many patients will report that they will have something like a time alteration. They didn't realize that they were in the chair as long as they were under the influence of the procedure. I'd like to talk a little bit here, hopefully I've got a signal back, about the impact of NuCalm over the longer term. You use NuCalm in your clinical practice, and not only does it manage the stress and the anxiety, at the end of the procedure, you're going to find your patient in a much better psychological state. There are few things that you can do with patients where if they come in for a procedure, they will feel in a better psychological state than they did before they came in. By managing the balance in the autonomic nervous system, you will also find that you will have better procedural outcomes because you can balance the stress response from the autonomic nervous system. All of the complex endocrine chemicals that get released in that system are in a better state of balance, and you can see things, for example, like a much better outcome in healing of tissues. All healing involves some level of inflammation, and if the inflammation cycle does not shut down at the right time, you can end up with over-inflammation and tissues that do not restore themselves correctly.
I'm going to take a few questions that have come in. If you could answer them for us, that'd be great. And then we're going to close tonight's call with a brief message from Miss Ashley Blank. So I'm going through the questions here, kind of scrolling down through them. Here's a good one. When NuCalming at home, what is the minimum time I should do it, and how would I get myself out of NuCalm if I'm by myself?
Well, one of my favorite times to NuCalm is really in the morning. I like to get up a little bit early, and 30 minutes is a good minimum, and you can get benefit at 30 minutes. The studies, for example, that Dr. Ping did at the Ray Institute at Harvard showed that an hour of NuCalm can give you the equivalence of like 2 hours of sleep. Those were done through heart rate variability studies with some of their new algorithms. So I like to have people that are using it for their own performance and their own balance to at least 30 minutes and about an hour. You will not stay under NuCalm for a long time. Usually, if you're using it yourself at home, about an hour. If you just give yourself a little bit of suggestion or even set a little timer or something if you're worried about not coming out. But 30 minutes to an hour is an ideal for personal use. Also, you can use it just 20 minutes, 30 minutes for like a power nap. I have a number of people that use it like power napping.
Okay, and how many times a week would you do it?
If you're starting, I think it'd be very interesting for you at least 3 times a week. I like people when they begin to try to do it maybe 5 times a week. We have some people that get up fairly early just get up maybe 30 minutes, 40 minutes earlier and begin your day with a little NuCalm exposure.
Great.
We call it meditation in a box because I'll just let you know one thing. In the new field of contemplative neuroscience, which is a legitimate branch of neuroscience, they are taking people and putting them under what is a meditative action for 90 days and seeing plastic changes in the brain for people with like long-term depression and otherwise. So it really has positive effects on mood state. One of the things you're doing with the NuCalm system is you're removing a lot of noise from the nervous system, just like in broadcasting, where broadcast engineers want to clean up the noise out of the signal so that the information is better. We clean up the pathways and the biological information is much more robust.
Okay. And I think there's a really good question that I see on the screen here. How effective is NuCalm in helping people with substance abuse?
It is useful. It's one of the reasons we started researching in this area. I do a lot of substance abuse work. We do neurotransmitter balancing of a little bit different type than we do. But there was recent research on GABA and alcoholism particularly. So since anxiety is such a, big issue in addictive diseases, and neurotransmitter imbalances are a big part of addictive diseases, NuCalm has a lot of applications for that population.
Okay, thank you. And then I think we have time for probably one more question here, and then I'll hand it over to Ashley. Can you use NuCalm with other sedation protocols?
Absolutely. One of the things to understand about the NuCalm system is that if you are using it in combination, particularly with halcyon or some of those, you will actually get a better effect. It will absolutely allow you to stay on box dosage for certain conscious sedation protocols. I will tell you that NuCalm and nitrous are an absolute marriage made in heaven. I don't think there's a patient you can't manage without those combinations. But NuCalm is very, very compatible with other sedation protocols.
I think there's enough subject matter there for a whole other call, which we might plan. So.
Well, there is, yeah.
Well, Blake, thank you very much. Really appreciate your insights tonight. I'm going to hand the call over.
I keep losing phone signal here.
Oh, we can hear you fine, so
okay. All right.
Not to worry. So I'm going to hand the call over to Ashley, who's going to close out with our a little special offer for the people who decided to join us for the call. So Ashley, please take it away.
Thanks, Jensen, and thank you, Dr. Holloway, for your inspiring and informative call. For all of the attendees, we really appreciate your time and interest in learning more about NuCalm, not only what it can do for your practice, but what also can do for yourself in helping to manage stress. So in light of taking care of ourselves, we've come up with the Inventor's Special Promotion. It's an opportunity for you that if you purchase the Gold or Platinum package of NuCalm, you'll receive a free system. And that system is for each of you to take care of yourself and to take care of your families. Additionally, for those of you on the call who are NuCalm clients, we are going to offer an additional 50% off your additional systems. So the Gold and Platinum packages, what they are, there are two different ways to get started based on what your patient flow is respectfully in your practice. One option is the Gold package. That's 2 NuCalm systems, and it comes with 720 applications. You also have your training and your support as well as a patient marketing package, and that also includes a 2-year equipment protection plan. Your Platinum package is 3 NuCalm systems and unlimited refills for 60 months. That also has a 5-year equipment protection plan. So both of those packages, if you move forward with either of them, do come with a free NuCalm system. This is a limited offer. So this offer will expire on Friday, May 16th at 5 p.m. Central Time. When you do call in to get some more information about these packages and take advantage of this promotion, you need to give the promo code BHN514. Again, that code is B as in boy, H, N as in Nancy, 514. And the number that you can call that's here on your screen is 877-668-2256. And again, this promotion will be available until this Friday, May 16th at 5 p.m.
Okay, thank you, Ashley. And thank you to everyone who came out tonight. I know it's for some of you, a lot of us are on the East Coast, and really appreciate you coming on with us tonight. For anyone who is registered for the call, we will have a recording available by noon tomorrow. I'm setting myself up for that one. So anyway, there will be a recording of this call available tomorrow before noon Central Time. And we really appreciate your presence here and hope it was useful for you.